This presentation will continue to look at health in developing and underdeveloped countries, but specifically focusing on religion and spirituality in Panama. This week, the reading will be from Holtz, Chapter 20, along with 3 additional online resources listed below. The objective for this week is to analyze the impact of politics, religion, and socioeconomic factors on the prevention and treatment of diseases and health threats. There are 5 key terms and concepts for this week. Their definitions are listed below. First concept is the politics of global health. Second concept is the religion of global health. The third concept is socioeconomic factors. The fourth concept is herbal medicine, and the fifth concept is cultural communication. Politics and global health. Political leaders are necessary for sufficient policy change to occur. Opposition and support of political leaders is expected throughout the country. Politics in Panama. The Isthmus of Panama used since 8000 BC for people to travel to South America. The United States had strong involvement in helping to build the Panama Canal and is now legally entitled to maintain the neutrality of the canal. The 3 main branches of government in Panama are the executive, legislative, and judiciary branches. The military in Panama is called the Panamanian Public Forces, and a special unit is used to counteract acts of external aggression. Socioeconomic issues in Panama. 28.6% of Panamanians live in poverty. The main crops in Panama are bananas, sugarcane, rice, corn, coffee, beans, tobacco, melons, and flowers. Panama is a major transshipment center because of its location. Tourism also provides income for Panama, as Panama has more than 50% of the world's floral species. Cultural communication in Panama. Topics such as income, salary, and investments are taboo, while topics such as feelings, beliefs, emotions are welcomed. Panamanians value closeness and togetherness, especially when in an inpatient facility. Avoiding eye contact, especially with medical personnel, is considered a sign of respect. Panamanians typically do not express disagreement with medical care or decisions by their physicians. Religion and spirituality in Panama. The majority are Christian, Roman Catholic. Panamanians take religion seriously and establish daily religious practices. Baptism is considered the most religious rite. Religious practices differ between rural and urban Panamanians. Herbal medicine in Panama. Panamanians practice traditional medicine as well as herbal medicine and seek medical care through healers. 61% of Panamanians use herbs to maintain their health, and 74% of Panamanians use herbs when they are ill. There are several global health threats and diseases. 2 of the more common are the recent Ebola outbreak and the development of ISIS. There is also a resource website on this slide which will provide you more information regarding these 2 recent global issues. The Ebola outbreak has happened in Guinea, Liberia, and Sierra Leone, and it demonstrates that an epidemic is not simply a biomedical problem, but one that has important social and cultural dimensions. If you demonize the backward West African villagers for their cultural practices, they are not going to cooperate with external and centralized containment programs. Knowing that villagers often associate a trip to a centralized medical center with death, you have to be culturally astute and sensible when providing medical care, especially in long-forgotten, poverty-stricken regions of the world. In Guinea, anthropologists are successfully helping medical specialists in their efforts to contain the Ebola outbreak. Sensitivity to the social and cultural dimensions of an epidemic goes a long way toward ensuring a significant degree of compliance and containment. Another most recent global threat is the development of ISIS. Below is an excerpt from a website listed under the resources that discusses ISIS, and especially in the Middle East, and concerns with the Islamic State. Religion also plays a part in global health, and below is a website that discusses how religion can impact and affects global health. There are several religious and faith-based organizations that are involved with global health. The main goals are to fight poverty, slavery, and world hunger. The top 4 Christian organizations are Compassion International, Food for the Hungry, World Vision, and Samaritan's Purse. There are socioeconomic factors related to global health, and below is a resource that will explain how this has been effective in Canada. Economic factors such as income, social connectedness, and education have a direct impact on an individual's health. For example, those individuals from a low socioeconomic status often lack necessary resources to achieve the most optimal level of health. Several determinants of socioeconomic health have been observed. They are income, employment and working conditions, food security, environment and housing, early childhood development, education and literacy, social support and connectedness, health behaviors, and access to health care. This is the end of the Week 5 presentation. Thank you for listening.